We are so excited to announce to our people Ghana that we are finally opened and we are accepting patients. At Bawuah Specialist Hospital, our extraordinary physicians and nurses are here to provide a high-quality medical service to our extraordinary patients. Our services include primary care services, maternal, neonatal, and pediatric services. We also have an in-house pharmacy. We have x-ray and laboratory services available to you. Come to us for all your healthcare needs and you will be happy you did because we believe the health is well. Thank you. And stay blessed. And we are at Bawuah Specialist Hospital, our extraordinary physicians and nurses are here to provide a high-quality medical service to our extraordinary patients. Our services include primary care services, maternal, neonatal, and pediatric services. We also have an in-house pharmacy. We have x-ray and laboratory services available to you. Come to us for all your healthcare needs and you will be happy you did because we believe the health is well. Thank you and stay blessed.
Yeah, therefore, your mamma adjo. And there, and you some can say, Emma Yinina. He said, Yanya, my maybe a baba will be a what being a war in lawyer. I brought from your friend of pharmacist. Oba acquire your first one. Your and your manage diabetes. And Muja Siciliary, yeah, if it's Siciliary. It no answer na me amanaba na afi wa abeka ho asemakyere mu me pese me kai se ye line no mo betimi afrain wo so se mo question bi am pese mbusa ana se mo betimi see where your line so Mr. Said you can be we are open for questions. Now line and number no I the whatever friend you 240 text line also here 510-931-0946. Near Yanya na and only ebekasa no or kind of brofoni trick any yafrefra. You know only Dr. Lizzie Bawuah. Agyeman ewo Delaware. Oye pharmacist achebe mfiebe eduni echiri ni. Abin wo pharmacist mpa ye. Eni ntino oni nipa obeka diabetes management no ho asemakyere. So here we have Dr. Lizzie Bawuah, who is going to represent diabetes management to all of us. So let us all open our ears and listen to this message. If you have any question, we have two lines here. You can call on 240-280-2633 or you can WhatsApp us in 510-931-0946. Here is she. I present her to continue with his message. Thank you and you're welcome, Dr. Bawuah.
Thank you so much for having me here today. I want to say good, I guess, evening to all of our guests from all over. It's a pleasure to be here today, and it's a blessing to have the opportunity to get to share a little bit about diabetes. It affects so many of us. In the US, it's not Ghana kakra. So treating also too much, and so as much as I can, I try to semi country, but to me, I can't hear Joe.
Why?
Yo, that's it.
And you know, bet my house here.
Okay. Okay. And yeah, okay, see, Mecca diabetes, just a Cydia diabetes, essay and Yama or yeah, how diabetes causes damage in our bodies. Before says, we shall see it, the way diabetes, it causes damage in your body now, and how diabetes over time that causes complications. So we shall.
Can you please increase your volume? I think your voice is very low.
Oh, it is. Okay,
Yeah.
actually, my volume is at its highest. So, would you mind pausing for a second, and I'll get some earphones, and I think that will help you hear me.
Okay. Let me pause then.
1 second.
Okay. Tisamre no ya train doctor no fabric to be abantino. Mungina mutie na mesense you can call us in 240-280-2633 or you can WhatsApp us in 510-391-0946. Today no is diabetes management. This is for the people aged maybe around 40 years plus. Those of you who have diabetes, it's a very good news to you. And I expect all of you to come and listen to this message. Because if you have any question related to diabetes and its management, this is the time to ask those questions. We have a specialist in pharmacy who deals with medication related to the treatment of diabetes. So come and ask all your questions. Those that we can answer them, we'll give you the answers. Those that we can, if there's a need for us to refer you to somebody or one of the doctors who is also expert, who is, they just tell you to go there. But meanwhile, I want you to listen to us through 240, or you can call us through 240-280-2633. And you can also WhatsApp us in 510-931-0946. Any question that you have, we are more than willing to answer this question for you. This is Era One Radio, the superb radio, the radio that communicates through the whole world. Anywhere that you are, you can get contact with us. Anywhere that you are, if you want to reach us, you can reach us. We answer questions, any type of questions. Now, again, here's a very interesting area that you can also do consultations. We have women's consultations, we have children reading consultations, we have what we call Ghana Munsam. We talk much about it, even though it's not a political related platform, but we deal much about the discussions. And the title of that thing is called Wonsum. Just come to and listen to Wonsum 2. If you come to listen to Wonsum, you always want to come here and listen to what we discuss here. So a platform who hear ye pa. Obodiana bra Era One Radio. A man of Poncomobia, sir, Cosiera with team man come out when you bet papa. So and finances, we deal with finances. The Quanya, a fast one, a huge ye. Quanya, a fast one, so top dines, so could be a bibia. A future send you on my and so Dwara Muta de ma eye niji pie. Now you are DBS friend and common kitty. No dear, a mabba one kwana will be she this uncommon and also radio tabaswa who say a niji sem kisipa. Bana my way, Mabawa ye will move in some to hold niji. The baby I will be your wife being said. Era One only being share. Oh, dear. Now, what cricket sharing? Now, they are more than for. Not sending that crap on my damn for. You are done for one sending come movie, not uncle sending come movie, no sending come movie. So the bear, Omun, everything, so someone, yet you any, and someone you can watch some was outline. So, in fact, so share programming is health, your health is you know, and also, you can be far up on to be a custom for Yaria Baya, your friend COVID, you can't COVID who has some quite fast or COVID city, so the year about COVID who buying now to be COVID no crying a day in Chichimu, I see. A pound fast or betting one casana couldn't be a woman who say when you be not near Ubit Makoye, a bit Mabuana, a swat, and as over transcribe in your cry, where any now bamboo, I can't want some mercy. Until the moon said, Sir, for me, unya nkwa ntra ho wonu binche moche na monche na monche na musunche na sa moche na moche na mugusu na mocha na moboa aboyade no ho bai nya nkwa na ka wasem ebi anse sabre ye ka diabetes ho asem emre atwam ye ka prostate ho asem ye ka hypertension ho asem ye ka kidney ho asem enti enema bebre on ma yesua free ye platform is enti se umpo unyantie bia wo de ko previous ones na ko hwehwe ni nyina obo nse bebre mu a yaka bia na wo de bi mu afa kura ya sa kan tontom asem de na tontom ye mai tontom awo be 300,000 more system mu kakra no of the yare ebre ye no kwan be so na ye betimi aboa na yabon try ade tontom yare no ba ade ni malaria ni ne keke ka no enti no ni nyina yaka wasem ya package no ewo ye history no ndu de ko ye history no ma chiri nyina obo se ni nyina ho no na time na ti na no yo nkonche monche na monche ma no nyina no bi se mo gusu na mo che no na nkofo benya ahotoso ewo ni ma ye ni nyina enti do opesa wo do asem bi brain na se wo question bi a wa kohwe ni nyina bi na apesa obisa ye misra wa ko sa phone number 240 280 2633 and now say WhatsApp here 510 931 0946 0946 and Jebia Dr. Lisa Bawuah Befe Obefa diabetes no I'm saying we do say Doctor Ekwanda ho utimi ekasa
Vasha ultimate menka okay.
Yes me ton kapa.
Okay, wonderful. Okay, into the I kind of said, and I'm sorry for the delay. Na me pay good earphones and what me at menka. Then I kind of said a good so we better diabetes na say the severe diabetes causal complications and diseases in your bodies. So what you see and Nobel born what you see in Rona Wofano, or better say reasons why what's often a sign no and the way in no yeah juma I bought your body no to fight diabetes. So basically when you have diabetes, what that means is that a woody nyama a high in carbohydrates like fufu, like rice, like banchit, say cassava, gari, those things, no, a high in carbohydrates, panel. Woody those things it goes into your body and turns into sugar. And normally, no, yeah, not well, cells not it make you the cells in your body use that sugar for energy. Like under normal processes, no, your cells will use sugar now. What do you know? It be used as energy to help you to do the things you need to do for the day. Like cooking, exercising, all the things your body needs to move to do, your cells will take that sugar and use it as energy. However, in order for your cells to use that sugar now with D as energy, no, here be I say key it be cells no. Sana you sugar now with D no, sa pan on our dinner and as a mo and as a fufu no. Now I take it sa sugar no into the cells to use it as energy. So the key no is referred to as insulin. So woody fufu under normal circumstances, you know, it will cause your body to produce insulin. The insulin will cause the cells to open up. Not cells, no, I take all that sugar that you ate out of your blood into the cells and use it as energy. However, when you type 2 diabetes, one of two things happens. Either your body doesn't produce enough insulin. And so let's say there are 1 million cells anka umbetimi yuzu sa fufu na wudi no. And so there aren't enough keys to open them up in order to allow them to take in that that fufu. And so as a result, sugar no fufu no will turn into sugar, and that sugar will end up sitting in your blood. Another thing that can happen is that your body may produce enough insulin, but your cells don't recognize it. So it would be similar to going home. So wakofie na wa you key so wo baby pron akọ odem. Na efe wo de key no share upon ni mo a and so I don't know, I'm a friend of that insulin resistance, meaning say well body no produce insulin, and so for whatever reasons no your cells do not recognize the insulin, and so the insulin is not able to open up your cells to allow it to take in that sugar that you ate. So in either way, the sugar ends up sitting in your blood. And as long as you're alive there, our blood no is running through our veins. When we are there, umojano is moving all the time through your body. When sugar is sticking to the blood, then as the blood is moving through your body, no, it ends up depositing that sugar into sugar not stick it to red blood cells, no, it will end up being deposited all through your body as that blood is running through your veins. It will deposit that sugar onto the nerves, going to those little nerves going to your eyes, and blood vessels going to your eyes, those little nerves and blood vessels going to your kidneys, those little nerves and blood vessels going to your legs. Over time, so one control how much carbohydrates are would sugar no blood never moving it through your system, and then over time all those blood vessels and nerves will become coated with sugar. When they become coated with sugar, this is where damage starts. And so imagine say with little blood vessels not say sugar coat no over time no it becomes damaged, and this is how diabetes can lead to blindness. And what Dr. Bekacha was said, once a year, kona check because say damage no ashasia at least who say okay damage na ashasia and they say at least you back say hey ebia fufu no teso kakra you say damage no ashasia, and I say a draw ofa no a little bit more. Na etimia bow na body na use sugar obedi na better. The same is the reason why a lot of people may end up with amputation to their toes, to their foot, to their leg. The reason is because sa blood vessels when it becomes coated with sugar, it becomes damaged. And so let's say what now baby na wakotia baby so normally side nerves na ekwa nine no beka che will brain and say hey what here baby so share one night, but over time so it becomes damaged that wunya sa message into wunni so one check with feet debia and share making sure say wunni cuts nessa near man wall nine won enti so wakate wo ho so a emoja na efri wo nine na ba no it will sugar and a bacteria so epe sugar enti sa site na atwa no the likelihood set ubenya infection no high because bacteria no per se ko because the situation wo ho enti so one check ya fa ubehu no na too late we be call doctor no na infected na the reason I doctor need to no if we said sa blood vessels no I say acid tunnel I say chains that the IV drug no share what antibiotic can normally be used to kill sa bacteria no or more de or mama IV blood vessels nanka e wo nanya e betimi dia drone up baby at we channel say there's no way you betimi dia drone alcohol. And just said, doctor, any choice said was amputated or nine. And I said, with toe, and I said, BBC. Another thing that happens with diabetes is all those arteries are echo wakoma, and I said, well, heart, those arteries are a de emoja echo wakoma no ene nutrients, then all that, when it becomes coated with sugar, then that increases your risk of heart disease. And as soon as we have diabetes, or as soon as Odakabeka said, oh, diabetes, no, that means that the risk of having heart disease is also high. And so this is how diabetes happens, and this is how it causes complications over time. Now, the thing with type 2 diabetes is that you have complete control. And by that, I mean that the first enemy is the food that you eat. And to say your problem with type 2 diabetes, problem is say, carbohydrates will. And unfortunately, your body is not able to process the carbohydrates very well. And he said, some carbohydrates, so we reduce it, and I said, we jaya. Then just said, body needs a problem, no. And sugar be a bunny more intimate process, yeah. The sugar that's going to stay in your blood and be moved around by your blood and cause damage. All that is cut out. Another way to control diabetes is through exercise. And so we exercise and not recommendation is said to say debia so we exercise for just 30 minutes. Say what joint problems bicycle exercise. And I told me no doctor akasa okay. Exercise being a if it's a we exercise what happens is that muscles we exercise our muscles say, hey, you hear energy, they be exercise. Into sugar beer muscles no be per se suck those sugars out of your blood so that it can use it to exercise. Now exercise, no, it doesn't have to be running, just anything. So we'll put bonyum for 30 minutes. Just any way to get the body moving will help to suck up that sugar so that it's not sitting in your blood and moving around and causing damage. Another thing, of course, is by taking your medications. Medications, our body, to better take up that sugar instead of the sugar sitting in your blood. There's different ways that medications, internet to be our doctor, 3-4 medications because nina yet different things our body, to use the sugar better. And so that is basically the gist of it all. What I want to also explain is the A1C. Until what diabetes now called doctor, oftentimes your doctor your A1C actually. Well, A1C, basically what it is the percent of your blood that has sugar sticking to it. And see, every 3 months, new blood. And blood at what say and net January 1st, 3 months from now, you're gonna get new blood. And the A1C tells you, say, over 3 months, how much of that blood that you had sugar sticking to it. And so if your A1C is a 10, that means 10% of your blood had sugar sticking to it over that 3 months. Now, I just want to put it into perspective. Obia only diabetes, the percent of their blood that usually has sugar sticking to it is anywhere between a 5 and a 5.5. Obia and diabetes, and yet well controlled, the percent of sugar that's sticking in your blood or their A1C is anywhere between above an 8 to like a 10 or higher. Now, so what should I say? On your and the diabetes, you're controlled, say a 10, for example, is 2 times the amount of a person who doesn't have diabetes. If your diabetes is well managed, your A1C is usually between about a 6.5 to a 7.5 or 8 or less. And so, say it last month, December, almost say A1C in your cry, 15. Why will be taking steps by decreasing the amount of carbohydrates, increasing the amount of vegetables. Well, yeah, why will be who said, A1C need less if you said with the less sugar. And so, and only the basic summary of diabetes and how it damages your body and ways that you can help to control it.
Okay, so me yebeti producer also or advert the person show. Producer, you trail na answer what was. So Omaya, ubi or person ubisa I'm Sitabe Dr. Bawuah am my information about diabetes and the management. And if you are there and you want to ask any question, please call 240-280-2633, or you can text us or call the WhatsApp at 510-931-0946. And right now, I think the producer is not ready. So if there's any other information, doctor, you can continue with that.
That is the basic gist.
Okay, then let me
Mhm.
start asking you questions on the idea that you have given us today. There's one or two things that you touched that I really need you to explain it further. When I go to hospital and visit my PCP, and then he tells me, oh, as I say, I got pricking finger. Now, I got pricking the finger. No matter taking my jacket too heavy. You show me that so we should blood sugar level a dear fancy bear 20 point something. Some jacket one on to year on bit my idea so the sikafa you need pediano sugar level.
Okay, yes. And most people who drew the age of 45 or older, when you go to the doctor, and I said, so weight, a little high when you become overweight. Usually, at least once a year, your doctor will check how your blood sugar is doing. And when we start pricking up, okay, so pricking up. Different kinds. So there's the fasting blood glucose. And on that, or prick before you've had anything to eat. And you wouldn't BBA or how much of your blood has sugar in it. The immediate amount of your blood that has sugar in it. So one more prick your finger now. Before you eat now, or blood sugar anywhere between about 70 to 80 to about 100 and 110, like 80 to 110 is about the average that they want to see. When they prick your finger before you've eaten and it's like 125, that is called prediabetes. So that means that you're not diabetic yet. However, you're above the range of 80 to 110. And so this is where they need to watch you. This is where they'll have to talk with you and say, hey, I said, well, body and process it sugar very well anymore. And exercise, reduce the amount of carbohydrates that you eat because the emphasis will be due stage out where you're full out a diabetic. Well, more prick with blood, not a fasted glucose, yet above 125, not. And just said, what do stage out where you're diabetic? And see, do how your A1C, and so I check it with A1C just over 3 months, and so how much % of your blood also has sugar into it. Into a sana and also in a 6, like anywhere between a 5.7 to a 6.4 or higher, then they say, hey, we believe you have diabetes. And depending on how high the A1C is or how high the blood sugar is. And so some people might say, well, minpesa will be out testing my blood because minpesa may fight insulin. Well, they're not immediately going to give you insulin. It depends on what the blood sugar is. And so when we prick your finger, now with blood sugar yet, well, fasting blood sugar yet above 200, like 250, that's extremely high because what it should be is 80 to 110 before you eat. So if it's If it's 250, then they need to act immediately because you are full-blown diabetic and you have a lot of sugar in your blood, and they need to help you immediately. So this is where they would probably say, hey, we need to start insulin.
Okay.
Mhm.
Okay, trust me, so.
Another test they can do is the random blood glucose. And to random blood glucose too. And random blood glucose means we'll call a doctor's office. No, maybe I know what did. And to I know who said, well, blood glucose no yet 300 or above. And also means that you're full blown diabetic, and you probably need to start out with insulin to get your diabetes under control. If it's less than that, your random blood glucose, they want it to be less than 200. So if it's less than 200, you probably don't have to start out with that. When you have
go ahead and explain. I'm coming. Just explain. I'm coming.
Okay. Before you've eaten, like I said, your blood sugar should be anywhere between 80 to 110. 2 hours after you have eaten, your blood sugar should be anywhere between 140 to 180. So when it is above that, that means that your diabetes is not well controlled. And you can make quick adjustments, like I said, to help to bring that blood sugar down. You need to communicate with your doctor and let them know, hey, my blood sugar after I eat is still 210. Or when I wake up in the morning, my blood sugar is 150, 200. This is where they start to make adjustments to your medications. And if you follow the medications and you also implement changing lifestyle habits like eating less carbohydrates, incorporating exercise, then you will see that your A1C will continue to come down. So that's basically the gist of it.
Okay, the next question is, we are Ghanaians, and most often we don't do frequent physicals back at home. So, and maybe I'm a farmer or I work in the office or somewhere else. How would I know, sir? And this thing that is happening to me, I might be a diabetic patient.
Okay. Well, some of the symptoms that you may experience from having diabetes is you may start urinating very frequently. And urinating frequently could be a number of different things. It doesn't mean you have diabetes. For instance, a lot of men that as you get older, your prostate starts to enlarge and you're not able to empty your bladder efficiently when you go to pee, so you may urinate frequently. So that doesn't necessarily mean you have diabetes, but that is a symptom of having diabetes. The reason is just your God made our bodies so perfect, and when your body senses that there's so much sugar in your blood, your body wants to get rid of it, so it causes you to urinate frequently. So that's what that is. Another symptom is that you may be thirsty a lot. You're just always thirsty. That's also because your body is so concentrated with sugar that it wants water to kind of dilute all that sugar in your blood. So it's causing you to drink a lot, and then you're peeing a lot, trying to get rid of that sugar. So it's a natural way for your body to compensate for that sugar. Other things, and these things could be for anything. You may just feel more tired. Some people may start to lose weight without really trying. Those are all signs of having diabetes, but it could be other things. So if you start to feel any of these things that I said, just go to your doctor and get it checked out, and just see.
Okay, somebody is in the air. Somebody just sent a message to us. So let me read it to you. Can you please differentiate between type 1 and type 2 diabetes?
Yes, definitely. Okay, so
thank you, Dr. Boston.
Okay. Type 1 diabetes affects only about A very small percent, I believe like 5% or less of the population. So what happens with type 1 diabetes is an autoimmune, meaning that your body attacks itself. And meaning that your body attacks. I think there's like some noise coming through, but it just means that your body attacks itself. So your pancreas is what makes insulin. So when you have type 1 diabetes, what happens is that your body starts to attack your pancreas, which makes insulin. And like I said, insulin is what helps your cells to use sugar. So when your body attacks the pancreas and continues to attack it, over time, it will kill your pancreas. So you don't have the capability of making your own insulin. And then with type 1, you need insulin in order to survive. And you might know actors like Haley Berry, they have type 1 diabetes. Type 2 is what I explained a little bit earlier today, is usually a result of obesity. Being overweight.
Hold on, yes, hold on. Somebody, do you want to talk, please? Hello, do you have any question for us? Okay, go ahead. The person will call again.
Okay. So type 2 is usually a result of being overweight. When you become overweight, there's different theories. Some of them say that when you become overweight, it's almost like your cells become blind to the insulin that you make. They can't see it very well, so they're not able to use that insulin very well to allow you to take up that sugar that you ate. And so type 2 is basically a result of being overweight, not eating the right foods that will reduce the amount of sugar in your blood. So type 1 is autoimmune.
Hello.
Type 2 is usually a result of obesity.
Yeah, Bajo, Kasa. Bajo, yetio, wow, kahalo no yetio, babodi na kababi akusa free. Na question for why?
Hello.
Hello, Mitio.
Hello.
Hello, we hear you.
Yeah, me person me person visa doctor question kakra. Me question and person me visa doctor ne say what run test na o doctor ka show so oh this time no sugar no na 105 in them before breakfast into watch out. Now what checking if fear is below 100 but I say and I'm already can go check in the lab no more kasa nintino. Now, my question is, at the end of the and does it have influence on so lab test the following day and
Okay. That's a very good question.
that's it.
Yeah, thank you. Yeah, so would you do very, very heavy your body was not able to get rid of it, but normally in about 8 hours or 4 to 8 hours, your body is able to digest the food that you ate. So it should not affect your fasting blood glucose, but it can because it depends on when you ate. So let's say you ate at 11 o'clock at night, that could affect your blood sugar. But so would the normal 6 to 7 o'clock in the evening, yeah, it should not affect your blood sugar in the morning. And now blood sugar now what kind? And so 100 when you woke up is fine. That's well within the range. That should not be concerning. When you get above 120, 130s, 200s, before you've eaten, that's concerning. But yeah, 100 is completely fine. I don't think that should have sounded the alarm for anybody.
Okay, that's it. I hope that my menati is here. I think that you wish a question in fact medication or not, we are not doing justice to ourselves. Being a pharmacist, I know that more lobia, modema woman, say glucofage, and then you let me ask you this question: what actually does the group metformin Glyphoside, what do they do
Okay.
to us?
Yeah, that's a great question. And it's a great question because, excuse me, it's important to understand how your medications work and why you're taking it. Okay, so metformin, like I said, when you have type 2 diabetes, one of the problems is that your body may produce enough insulin, but your cells may not recognize it. Your cells need to recognize the insulin because insulin acts as a key to open up those cells. And when those cells open up, then that fufu that you ate goes into those cells instead of the sugar sitting in your blood. What metformin does is it allows your cells to better see the insulin that your body makes. So I'll repeat that again. What metformin does is it allows your cells to better see the insulin that you made. So it's kind of like putting some glasses on your cells to allow them to better see the insulin that you make. That way, it can recognize the insulin, and then the insulin can open up those cells and take in that sugar that you ate. So usually when someone is diagnosed with diabetes, unless your blood sugar is extremely high, meaning that your random blood sugar is above 300 and your A1C is above 10 or so, unless it's that high, they usually will start you out with metformin. The reason is because it's been around for a long time, it's been studied. It doesn't cause you to gain weight. It helps to preserve your pancreas. And so, well, pancreas, no, and it produces insulin. When you lose your pancreas, you have to take insulin. And so, what it does is it helps to preserve your pancreas by allowing your cells to recognize that insulin that your pancreas is making. It doesn't put pressure on your pancreas to make more insulin, which is what a lot of other diabetes medications do. And so it will cause your pancreas to last longer, so your chances of having to take insulin is less. Also, it's been shown to also improve your risk of cardiovascular disease. So it decreases your risk of getting cardiovascular disease. So these are all the reasons why. Now, one thing that they look at before they put you on metformin is your kidney function. If you have very bad kidney function, they're not going to put you on metformin because it will increase your risk of a side effect called lactic acidosis. And that's basically like horrible muscle cramp. I don't know if you remember maybe when you were younger and you exercise really hard and you got this awful cramp in your leg. That's what lactic acidosis is. So metformin is not to be used in people that don't have very good kidney function. And so that's basically how metformin works. Another side effect of metformin, if you start it, is that it can cause your stomach to hurt. It can cause discomfort in your stomach. One way to avoid that is by eating before you take it. It will help you to better tolerate it. There's different kinds of metformin. So one immediate release and one extended release. And so what say what the immediate release? Not the be alpha or tell your doctor and they can try the extended release. The extended release means that it doesn't all release into your body at once. It's extended. It releases over an extended period of time. And so your body kind of gets it slowly so that it doesn't affect you as much. And again, taking food with it will definitely help you. But that's the basic main common side effect of metformin is the stomach discomfort.
Okay, now can you talk a little bit about glyphoside too?
Yes, I'll talk about glyphoside. So glyphoside, glimepiride, glyburide, they all are a group of drugs they're drugs, they're all sisters and they're in this class called sulfonylureas. And so how that drug works is it puts pressure on your pancreas to make more insulin. And so basically, like I said, with type 2 diabetes, what happens for some people is that your pancreas doesn't make enough insulin. right? So when you eat fufu, your pancreas, there might be a million cells that say, hey, I'll take that fufu and use it as energy to help you, clean up after. But there aren't enough insulin, there aren't enough keys to open up those cells to take up that sugar. So what Glyphoside does is it forces your pancreas to make more insulin so that your body can better use the sugar that you just ate. And it's a good drug, especially Glyphoside, because even if your kidney function is not that great, it still works well. It doesn't need your kidney function to be great to use it. The only main side effect, and it's usually once a day or twice a day. The main side effect with it is it can cause your blood sugar to drop below the norm. And so you definitely want to have a little bit of something to eat before you take the Glyphoside. And so that's the main side effect to just know. If your sugar drops, you know what to do. Drink. I would always recommend drinking something, because when you drink, it goes straight into your bloodstream. So just drink a cup of orange juice and you'll know your blood sugar is low, because your fingers will get jittery, your heart will start to race, you may start to sweat. And you can check it. You can prick your finger and also check it. But yeah, just drink some orange juice and that will help to bring your blood sugar back to normal.
Yeah,
it's not a common it's not a frequent side effect, but it is a common side effect. So it's something to know while you're taking the medication.
Somebody is asking this question.
Mm-hmm.
Sir, why do doctors or why do you pharmacists most of the time give glucophage and Glyphoside together? Why?
Oh, yeah. So glucophage and Glyphoside both act differently, like I just said. And so usually it's because you need a little bit more to help with managing your blood sugar. So initially your doctor will start you out with Metformin, right? And then if your A1C is still above the normal, your A1C is still, 9 or 10, or above a 7.5, then they're gonna want to add something else like Glyphoside. The reason why they add those two is, one, those drugs are not too expensive. Two, they can help to significantly bring down your A1C. So both of them are able to bring down your A1C by as much as almost 2%. So let's say your A1C is a 10. Those medications have the capability to bring it down to a 7, if it's effective. So that's why I usually start out with those.
Yeah, the next question that I'm getting here is that, what is the best time to take these medications in order to control your diabetes?
Yeah, I would always recommend, if you're taking it depends on the medication. But for most diabetes medications, taking them in the morning is the best bet. The reason is, some people may take it at night. And if you take it at night and you realize that you are starting to have like nightmares, you're having a lot of nightmares, that's a big side effect. That's something showing you that your blood sugar is dropping lower than the normal when you're sleeping. Right. So when you're awake and you take it in the morning, if your blood sugar is low, you'll know, it will feel like how it feels, let's say, when you're hungry, when you're really hungry, like you start to shake a little bit, you start to sweat, okay, my blood sugar is low, I'm going to drink some water. But if you're deep asleep and your blood sugar drops, you won't know. So you may have nightmares and you won't know. Some people, if it goes really low, you could get into a coma. So unless your work schedule, you might work at night and maybe that's just the best time to take it, then that's fine. At least you're up. But I would take it in the morning. There are other newer medications like Jardiance, for instance, that also cause you to urinate out any sugar that's in your blood. And so that's going to also cause you to pee frequently. And that one you don't want to take at night, because you're going to keep getting up to pee and you're going to wonder why you're peeing so much. It's because that's the way that drug works. It causes your body to pee out any sugar that's in your blood. So for most diabetes medications, I would just take those in the morning. But take it at the schedule that's best for you, because the most important thing is that you take your medications.
So you bet me akase is that the same way that metformin and glyphoside work? Is it the same way that the insulins like Lantus and Novolog and all kinds of group, do they do the same function?
No, they don't. So like I said, metformin allows your cells to better recognize the insulin that your body makes, so that it can use okay, so your cells recognize, okay, so insulin acts as a key, right? And it opens up your cells and allow them to take any sugar that you eat into your body, right? One of the big things about type 2 diabetes is insulin resistance, right? You hear insulin resistance, insulin resistance. Insulin resistance just means that your body is making insulin just fine. Your cells don't recognize it. And so what metformin does is it helps your cells to better recognize the insulin, and so that the insulin can open up these cells and allow them to take in that sugar and use it as energy. So that's what metformin does. Glyphoside, what it does is it helps, it forces your pancreas to make more insulin, because the problem for some people is that they're not making enough insulin. So their cells aren't able to use up that sugar in their blood very well. And so what glyphoside does is it forces your body to make more insulin so that you can use up that sugar that you eat. Now, Lantus is considered a long-acting insulin. So this is where you've gotten to the point where your body is just not making enough insulin. There's no help. There's not a whole lot of help that can be given to your pancreas to make enough insulin. So then they have made insulin for you to take, so that your cells can use up any sugar that you eat. Lantus is considered a long-acting insulin. So what that means is it acts all day and all night to help to keep your sugar levels steady. Now, you need to understand the difference between Lantus and, let's say, Novolog. Novolog is considered a rapid-acting insulin. And so what that does is, as soon as you eat, so let's say it's breakfast time and you had some bullfruit and tea, right? What Novolog does is it will bring down your sugar right away, because those things are going to raise your sugar, so it will bring it down right away. So they're basically giving you insulin because your body is not making an adequate amount. That's what Lantus is, an insulin. Novolog is an insulin. Is to replace the one that your body is not making adequately.
Okay, thank you for Miss Dr. Bawuah. Let me do my advert now before I continue my questions.
Sure.
Yɛka diabetes ho asɛm. Diabetes na yare bi a sɛnea Dr. Bawuah ka ho asɛm no ɛyɛ yare a ɛsɛ wo nerves. Nti kuro ba bɛtɔ ho a ɛmu da. Ɛsɛ w'ani. Nti no ɛyɛ yare bi a ho hia sɛ obi ate aseɛ na ɔbɔ ho ban ɛfiri ho. Ɔmo onnuro a ɛde bɔ ho ban nti no ano na Dr. Bawuah akyerɛkyerɛ mu akyerɛ yi. Ɛno nti sɛ wowɔ question bi na apɛ sɛ wobusa yɛn a mesrɛ wo a frɛ 240-280-2633 anaasɛ sɛ wowɔ baabi a apɛ sɛ WhatsApp yɛn na wodi question bi ba na wotie answer frɛ yɛn 510-931-0946. Yɛayɛ ready wɔ ase sɛ wasɛm bi a mebisa biara no yɛbɛyi wa no. Enti no yɛatoa so no na mebisa question baako a ɛm sɛ bɛfa yɛ nyinaa yɛ ho. Na woka biribi sɛ nnuro a yɛnom no ebi ɛboa ma ebie yɛ cells mu ama sugar ni ebi nya kwan kom. Na ano na nka yɛnom aduro na nka sugar na ɛwɔ mu nyinaa no emie ma no nkɔ one time na afei yɛnom yɛde biara yɛnom aduro no.
Oh, okay. Okay, yeah, that's a really good question. Unfortunately, Adrobia lasted for just a few hours. Intina, and Nobi Waha, it to me lasted in our system for a week. Inti, yeah, na manufacturer, na ka say, okay, wait there. It's me a dreamer for a week. Inti, it was for just once a week. And Robi Wawa, it's me last year in our system for just 12 hours. And one the way a drug company no make it. And South Side no almost say, okay, doctor and I say fun twice a day. If you say after 12 hours, no, and yeah, you it was all fun, it was all fun 12 hours. It was all fun on you, right? And sana in Robia, yeah, Jumanya just diabetes medications. It's all for Drobia or yeah, once a day. If you say in your body, no, is made to just work for 24 hours and that's it. And then after 24 hours, no, your body has cleared it out. It could peak. Yeah, your body not clear. What's after you? And in the future, you been in for one time, not and one no. But currently, no, but your mental won't come.
Let me share a question. We say.
Yes.
Madam Fubina, Obusan question. I'm say obi a we na no with TNT Bawuah. Ono order Metformin and Glyphoside and or Lantos. Na ni sugar na anopa bia no e normal. Anwumre na ya na ekoslo kakra. Na didi enso no esanse and odidi mprenu da bia na wadi snacks be ni bia kan. Sa nipa we wutunufo a anka foto be nso ne A1C 9.5 for baby to me bia na cotton. Sa nipa we sugar level from no anopa bia no e wo fom. Enya A1C so was no. Enti no kwan be so na ogidi se wontimi regularizing the blood sugar.
Okay. Somebody like that, you know, it will say who exactly they would, because Abia obedi twice a day, but would Abia so would Abia obedi Abia no play obedi, I don't know, Abia cocoa. Na area would di a more dear ma, you know, with different things. And just would eat too much carbohydrates at night, in the afternoon, what would do nighttime no check, yeah, maybe our blood sugar is still a little bit high. And to somebody like that, you know, men can't be I say be a any phobium and I say any mobium. Yeah, my kind of says wouldn't you A1C goal now, Pat, which at least you should try to get it below an 8. If you have not gotten there, decrease it carbohydrates, no, and to say be a 1 bowl of rice. Cut the bowl of rice into half and let half of it be vegetables. And by vegetables, there are certain vegetables that are also high in sugar, like peas and carrots are high in sugar. So they may kind of say squash, broccoli, cauliflower. So we'll pay control say, hey, okay, you know, just decrease the amount of oil, you know, but you can eat stuff like that. We'll pay nkrumah. You know, nkrumah say it's good for you. You know, things like that. Well, so nkrumah, sa yo de beka you know, benku or something like that. Make it very, very small. Nema nkrumah ninye bebre, nema nebia wama fish with the fish akahu. You know, those things are good for you. And the American say bia wadam for no, ebia for breakfast and lunch, you know, the carbohydrates no high. And even though they're eating twice, when they get to evening, the blood sugar is high. But the reason why the blood sugar is probably low in the morning is because they take the Lantus at night. And the Lantus helps to steadily keep the blood sugar low until, you know, for at least 12 to 24 hours until not ABI and the blood sugar is like 80, you know. So there's like, why is my A1C high? Well, decreasing vegetables, no. Not will incorporate a little bit of exercise. Who said A1C? I mean, or decrease carbohydrates. I'm sorry, or decrease carbohydrates. No, increase vegetables. Now, who said? You know, also snacks. No, it was all shiny. It's already nipa beka say okay. To say there, you know, it's a new year. Maybe be healthy. Maybe fruits. Maybe you know, fruits. No, high in sugar. A lot of fruits are high in sugar, and so at this point, your body doesn't recognize the difference between sugar from a cake or sugar from grapes. And so when you decide to increase the amount of fruits, your blood sugar is going to go up. And so, especially dried fruits, they're just concentrated natural sugars, you know. And so what I would do is, if the snacks are fruits, I would definitely significantly reduce the fruits and replace them with, you know, vegetables like celery or other things that are not high in carbohydrates. Beans are great. Beans are great because they help to get you full without really increasing your blood sugar, and also they help to clear out toxins in your intestines because they're a good source of fiber. So, you know, I would incorporate all of these things into your diet, because it could be a say, well, maybe vegetables, no, it doesn't fill me up. Yeah, so try and add beans to it, and you'll see that it will really help to fill you up and help to control your blood sugar as well. Oh, you're on mute. I can't hear you. I can't hear you at all.
Thank you
Okay,
very much.
sure.
I know that that my friend is really listening to us. So our time is almost there. So can you please give us a summary? If no question comes, maybe then we'll put the whole thing to an end.
Okay. The summary of it all is that diabetes is a disease that affects a lot of people. Um, Sometimes the complications that can result is because some people are in denial that they even have diabetes. And being in denial is not going to cause the complications to become less. If your doctor says that you have diabetes, you can control that. It's not out of your control. You can increase the amount of vegetables. And in our diet, in the Ghanaian diet, there are a lot of good vegetable options, you know. So open contemporary stew, for instance, do the contemporary stew with vegetables like cauliflower rice or vegetables instead of a big bowl of rice. Open kuruma, that's great, you know. It's just that the older become kuruma no hono, benku or whatever, no. Maninye very, very, very tiny. Naman krumano and a fish, no, and yeme bread. Exercise, and by that I mean do what you can. You know, if you can just cut out 30 minutes of your day to just dance, to take a walk around the neighborhood. If you have a bicycle, to sit on it for just 30 minutes, it will significantly help you relieve stress. Some people eat a lot when they're stressed. I tend to eat when I'm stressed. Bringing down your stress levels is very important for your overall health. I don't think that we talk about that enough, and that's probably for a whole nother segment. But look at your life and the amount of stress that you're under, and try to figure out ways to manage your stress. You know, prayer, meditation, journaling, because when you are less stressed, you're able to make better decisions overall and good decisions for your body. Stress can also increase cortisol levels, which is steroid in your body, which can cause your blood sugar to go up. And so all that is important. So I would just say, if you have a diagnosis with diabetes, feel empowered that you can take control of it. You can bring it down. You know, don't be in denial about it. Take the medications your doctor gives you. And then most importantly, also implement lifestyle changes, because I've seen plenty of patients that made lifestyle changes, lost weight, ate right, and have been at the point where they didn't need any medications. It's not a life sentence. It's just a decision to redirect decisions you're making for your health so that you can become more healthy. You're on mute. I can't hear you. I can't hear you.
Okay. Dr. Bawuah, I think this knowledge here, what imparted to us, it's not limited to United States here. It goes all over the world. And then hopefully questions may come from somewhere. We're not getting them now. The studio manager will be writing them down. So the question will come. So I hope we're going to invite you one more time for some of these questions to be answered. And with that, I want, on behalf of the studio director, I want to thank you for spending your full 1 hour to tell us more about diabetes and how we can control it. We thank you very much. And once again, I say thank you for the work that's done for us.
Oh, thank you so much for having me. And thank you for all you're doing.
Because actually I hit Ghana, is slow and is killing Ghanaians. Right now that we have given this idea, those who are sharing should continue to share and share, particularly if you are old. Just listen to this and know how you can manage your diabetes. I think if you manage your diabetes, you will live longer. Other than that, you're going to live a short life in this world. Thank you, and we'll talk again.
Thank you.
Bye-bye.
Hello, beautiful people of Ghana. This is Bawuah Specialist Hospital. We are so excited to announce to our people Ghana that we are finally opened and we are accepting patients. At Bawuah Specialist Hospital, our extraordinary physicians and nurses are here to provide a high-quality medical service to our extraordinary patients. Our services include primary care services, maternal, neonatal, and pediatric services. We also have an in-house pharmacy. We have X-ray and laboratory services available to you. Come to us for all your healthcare needs, and you will be happy you did, because we believe